Narrowband Imaging in Diagnosing Deep Submucosal Colorectal Cancers, a Systematic Review and Meta-Analysis. Introduction. With advancement of the new techniques of endoscopic mucosal resection and endoscopic submucosal dissection, ESD, early colorectal carcinomas, CRCs, can be resected less invasively compared with surgical resection. Studies have demonstrated that lymphatic metastasis rarely occurs in intramucosal cancers and that superficial submucosal cancers, SSMCs, can be defined as cancers with submucosal invasion of less than 1,000 micrometers. In contrast, deep submucosal cancers, DSMCs, defined as cancers with submucosal invasion deeper than 1,000 micrometers and with a lymphatic metastasis rate of 8.6% to 12.8%, should be surgically resected. Therefore, intramucosal carcinomas and SSMCs can be resected endoscopically, but they must be carefully differentiated from DSMCs. Magnifying endoscopy, defined as endoscopy used to observe the microstructure of the gastrointestinal mucosa under magnifying view, has been developed with a magnifying power of 75 to 125 for the Olympus endoscopy system. Magnifying chromoendoscopy, M-CE, has been widely used in differentially diagnosing DSMCs from SSMCs and intramucosal carcinomas using the PIT pattern with high diagnostic efficacy in Japan. Recently, narrowband imaging, NBI, and optical technology has been developed. Magnifying endoscopy combined with NBI, M-NBI, has enabled real-time diagnosis by allowing the surface structures and mucosal microcapillaries to be more carefully observed. Several classification systems for NBI surface pattern have been proposed for real-time diagnosis, such as the Sano classification and the Hiroshima classification. In recent years, multiple studies have been conducted that have explored the diagnostic performance of M-NBI in differentiating DSMCs from SSMCs and intramucosal neoplasms. In addition, the European Society of Gastrointestinal Endoscopy, ESGE, guideline has suggested the use of M-NBI and M-CE in predicting the risk of invasive cancer and deep submucosal invasion. However, their sensitivities varied from 0.38 to 0.97, and the conclusions are controversial. Furthermore, there was no systematic review or meta-analysis that had pooled the diagnostic efficacy data of M-NBI in the diagnosis of DSMC. Therefore, Zhang et al. Conducted a systematic review and meta-analysis of the sensitivity and specificity of M-NBI in diagnosing DSMC and compared the diagnostic efficacy of M-NBI with that of M-CE. Background and study aims. Magnifying endoscopy with narrowband imaging, M-NBI, has been widely used in the differential diagnosis of deep submucosal colorectal cancers, DSMCs, from superficial submucosal cancers, SSMCs, and intramucosal neoplasms. Zhang et al. Aimed to pool the diagnostic efficacy of M-NBI and compare it with that of magnifying chromoendoscopy, M-CE, in diagnosing colorectal DSMC. Methods. PubMed, Embase, and the Cochrane Library were searched to identify eligible studies. Meeting abstracts were also searched. A bivariate mixed effects binary regression model was used in the meta-analysis to calculate the pooled diagnostic efficacy of M-NBI and compare it with that of M-CE in the diagnosis of DSMC. Subgroup analyses and meta-regression were conducted to explore sources of heterogeneity. Results. The authors included 17 studies, 14 full-text, and 3 meeting abstracts. The pooled sensitivity, specificity, and area under the summary receiver operating characteristic curve, AUC, with 95% confidence intervals, CIs, in diagnosing DSMC were 74%, 98%, and 0.91, respectively, for M-NBI. The pooled sensitivity, specificity, and AUC were 84%, 97%, and 0.97 respectively for M-CE. M-NBI had lower sensitivity than M-CE with similar specificity. Subgroup analyses and meta-regression indicated that endoscopic diagnostic criteria study type, endoscope type, risk of index test bias, and histopathological diagnostic criteria might be the sources of heterogeneity. Conclusion. M-NBI and M-CE had comparable specificities in diagnosing DSMC, but the sensitivity of M-NBI was slightly lower than that of M-CE.